Questions without notice. The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister. Under John Howard, Bronwyn Bishop lost her job when an aged care resident died in connection with the kerosene bath scandal. Aged care residents are now so neglected that up to half are suffering from malnutrition, one had ants crawling from open wounds, and over 400 have died from COVID-19. Why does the current aged care minister still have his job?
The Prime Minister.
Speaker, because under this aged care minister, $1.5 billion of additional support has been put into the aged care sector during the COVID-19 crisis. Mr Speaker,
members on my left.
When additional resources are required to address the significant challenges in the aged care sector, Mr Speaker, the minister has consistently brought forward submissions for additional support to be provided right across the board in the aged care sector, whether it's to ensure the viability of the sector, to ensure that there's additional and appropriate training that is being provided, Mr Speaker, there's additional workforce support, $1.5 billion, including the more than $500 million that was announced by the Minister for Health and the Minister for Aged Care today, Mr Speaker, just today, to ensure the extension of COVID arrangements, which is necessary. Mr Speaker, this is a challenging crisis. I think we all understand that. And what we always do when it comes to the support that we're providing, whether it's directly to Australians through things like JobKeeper or JobSeeker, or the supports that are necessary for the aged care sector as we address the significant challenges there, particularly in Victoria, where we've had the significant outbreak of community transmission. On each occasion, we will continue to assess the needs and the supports will be provided, as the announcement of an additional more than $500 million for aged care support, which extends the current arrangements of additional support further because of the situation, particularly that we have seen in Victoria, where there has been additional challenges on the system following the significant community outbreak that has occurred. But in addition to that, Mr Speaker, it has also been the strong advocacy and work of the Minister for Aged Care that has ensured that our government has kept pace with continuing to increase the number of in-home aged care places in this country, Mr Speaker. 10,000 additional places we took to the last election, and since then we not have only provided those 10,000 places, Mr Speaker, but an extra 16,000 on top of that, and that was done, Mr Speaker, with the full support and advocacy of the Minister for Aged Care.
The member for Moncrieff.
Thank you, Mr Speaker. My question is to the Prime Minister. Will the Prime Minister update the House on how the Morrison government is focused on securing Australia's future by building the road to economic recovery from the effects of the coronavirus pandemic?
The Prime Minister has the call.
Thank you, Mr Speaker, and I thank the member for her question, and I thank you for the tremendous work she's doing on the Gold Coast with our other members from the Gold Coast, Mr Speaker, dealing with those difficult challenges that are there at the Gold Coast, whether it's whichever sector it's been in, whether in the entertainment sector, in the tourism sector, in the event sector, Mr Speaker. The member has been a keen advocate, both directly to myself, the Treasurer and the many other ministers. Mr Speaker, Australia is making our way back. We are making our way back, Mr Speaker. There's been a more than 60% recovery in the stock market since the hit of the COVID-19 earlier this year, Mr Speaker. There's been 343,000 jobs, Mr Speaker, that has been re-established in the economy after that first hit, Mr Speaker.
Rankin,
there has been a 50% of the losses in aggregate hours worked in this country have been recovered since that first fall, Mr Speaker. Consumer confidence has recovered 80% of the losses since that time, as has business confidence, according to the NAB survey. There's been a 13.5% fall in loan deferrals in July, Mr Speaker, and there's been $250 billion raised in bonds and T-notes on bonds are more than 4 times coverage. That has enabled us, Mr Speaker, to be able to provide the JobKeeper and the JobSeeker support because of the strong financial position of the government as we went into this crisis, which meant that we could raise the funds in those markets to ensure that JobKeeper, which has been a lifeline to Australians, as has JobSeeker throughout the course of this pandemic. But we have to focus on the road back as well, Mr Speaker. We need, as we continue to journey back, and of course the Victorian wave of this pandemic has meant that the stall in the recovery that we were going through, Mr Speaker, where we were on that road to recovery in June, Mr Speaker, of course that slowed things down. and that has not just impacted Victoria but has affected other states and territories as well. But what we need to do is continue to focus on the road back. The restrictions and the arrangements we have today, Mr Speaker, are not things we want to see by Christmas, Mr Speaker. What we want to know is what's going to happen when we get to not just September 1, but October 1 and November 1 and December 1 and January 1, because, Mr Speaker, our economy needs to continue on the road back. And we need to continue to work together to ensure that we can open up the economy safely, Mr Speaker, just as we were doing in May and June and as we were going into July, and as we hit the big setback that we did hit, Mr Speaker, with that second big outbreak in Victoria. What we now need to focus on is ensuring that road back. But the road back is also a longer-term road back, and that is the support for training and skills, with more than $3 billion committed by this government for training and skills, affordable and reliable energy, particularly in the gas sector, Mr Speaker, infrastructure bring forwards of almost $10 billion, Mr Speaker, whether it's in water or in roads or indeed in energy where that's required, supporting manufacturing and our defence manufacturing industries in particular, easing the cost of doing business and supporting industrialisation flexibility.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister. The Aged Care Minister has boasted he has responded, and I quote, incredibly well, that Australia is in a, quote, good position and that we are extremely fortunate to have hit a, I kid you not, high watermark on aged care. Why is the government congratulating itself on a job well done when over 400 aged care residents have died?
The Prime Minister has the call.
Thank you, Mr Speaker. Every single one of those deaths is a great heartbreak for every single one of those families, and for the member to suggest that the government doesn't feel that way, I don't think is an honest reflection of the government's position or the minister's position, Mr Speaker. That is not the minister's view. It is not my view. It is not the members of our government's view, Mr Speaker. What I can say, though, is that when we came to government, Mr Speaker, the annual expenditure on aged care was $14.2 billion. In the recent budget, Mr Speaker, it was $21.4 billion. The number of in-home aged care places has increased from 60,000, Mr Speaker, to more than 150,000 places, with 97% of those who are waiting for an in-home aged care place already receiving at least some form of support for their aged care condition, Mr Speaker. So, Mr Speaker, whether it's on the increase in funding for in-home aged care, whether it's in the overall increase in funding for residential aged care, whether it was the establishment of the Aged Care Quality Commissioner, Mr Speaker, whether it was the instigation of the Aged Care Royal Commission by our government, Mr Speaker, and the extension of its inquiries into issues directly related to COVID. Mr Speaker, this government will continue to invest more every single year in aged care. In the next budget, we will invest more. There's been some $3 billion investment in additional in-home aged care places, Mr Speaker, in just the last 3 years. And I do note this particularly in relation to in-home aged care. At the last election, we took to the election a policy that was set out in our budget of 10,000 additional aged care places. That's what we set out. Not more than, it was about 18 months ago, Mr Speaker, when we set that out and we took that to the Australian people. Those opposite at the same election agreed with that plan. They thought the 10,000 figure was exactly the right plan because they did not offer one additional place as part of their election plan, Mr Speaker, despite raising some $387 billion in additional revenue that could have provided for additional places. What did our government do? We not only committed to those 10,000 places, Mr Speaker, we provided an additional 10,000 beyond that in the MyEFO that followed, an additional more than 6,000 beyond that, bringing the total to more than 26,000. So, Mr Speaker, those who come into this place and want to make recommendations about aged care need to look at what they put to the people at the last election. They supported the government's plan at the last election before the COVID crisis, and I'll leave others to conclude as to why they're raising these issues in this context now, Mr Speaker.
I call the members on my left. Members on my left. The member for Lyne has the call.
Thank you, Mr Speaker. My question is to the Deputy Prime Minister and Minister for Infrastructure, Transport and Regional Development. Will the Deputy Prime Minister inform the House how the Morrison-McCormack government, through investment in critical infrastructure, is providing a pathway to recovery from the COVID-19 pandemic?
The Deputy Prime Minister.
Thank you, Mr Speaker, and I do thank the honourable member for his question. Mr Speaker, the member for Lyne works hard for creating jobs in his electorate, Mr Speaker, and I know how hard he works for local government and ensuring that they've got the money, they've got the funds federally gained to help with the local roads and community infrastructure projects and programs that are rolling out across his electorate, Mr Speaker. He knows that the recovery and the relief efforts out of COVID-19 are going to ensure that jobs in his electorate and jobs throughout the other 536 local government areas of this nation are going to be so vital for that pathway out, Mr Speaker. In Lyne, the infrastructure program is rolling out as it is across the rest of the nation, $100 billion over the next decade. And we want to put in place the roads, the rail, the airports, all the infrastructure that is going to help ensure that we get through this crisis. Millions of dollars will be spent across local government areas in the Lyne electorate, and the member for Lyne is fighting hard for those jobs. 85,000 jobs. That's what the 10-year plan, the blueprint, the vision that we have for our nation is supporting, Mr Speaker. There's no better example of the Australian government's infrastructure investment program, Mr Speaker, than the 1,700-kilometre corridor of commerce, the Inland Rail. It is ensuring that regional New South Wales, Victoria and Queensland are going to have that 24-hour access to the ports of Melbourne and Brisbane, Mr Speaker. Some of these 16,000 jobs that project is supporting have been realised in the Parks to Narromine section. I was there on January 15, 2018, when the first shipment of steel, Whyalla steel, Australian steel, that's Australian jobs, was dropped off at Peak Hill for the start of that project. Already, One Steel in Whyalla has supplied 14,000 tonnes on the Parks to Narromine section and nearly 25,000 tonnes for Narrabri to North Star. As construction of the further 12 sections of the Inland Rail continues, that means more jobs. That means regional Australia is going to be benefiting from this absolute nation-building piece of infrastructure. Stephen Stewart of SLS Transport in Geary, south east of Dubbo, he said we've put on an extra 5 staff, been able to invest in some of the extra plant equipment. We've always tried to spend locally on repairs and maintenance to help the community. That's what they do. That's a great little small business, just like the small businesses in the member for Lyne's electorate, Mr Speaker. They benefit when we spend money in local councils, through local procurement, through making sure that those small businesses have the support federally gained from the programs and projects that we're rolling out. These projects are vital to the pathway to recovery. These projects are important for regional Australia.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister, and I refer to his previous answer, where he questioned why Labor was raising the aged care question in this parliament. Does the Prime Minister seriously not understand that it is legitimate for Labor to be asking questions in this parliament on behalf of the more than 450 families who are grieving lost loved ones who have been lost during the COVID-19 crisis?
The Leader's time has concluded. The Prime Minister has the call.
I do acknowledge that, Mr Speaker. I do acknowledge that, Mr Speaker. What I was implying, so maybe I can be more direct, Mr Speaker, so the Leader of the Opposition is not confused about my position. In my answer to the last question, Mr Speaker, I set out very clearly that at the last election the government took a policy to that election which set out some 10,000 additional home care places to support people who are elderly in this country, to ensure that they get the care. Mr Speaker, every single death in aged care, whether it has been through this COVID-19 crisis or at any time, is of great grief to the families who are involved. And I'm not suggesting that there is one person in this place that does not grieve with those families and extend our sympathies to each and every one of them, Mr Speaker. What I was simply noting, Mr Speaker, was this, that at the last election, in fact at the last election, We took to that election, Mr Speaker, some $725 million in additional commitments in the aged care sector, which included the additional 10,000 in-home care places, Mr Speaker. That was followed up, Mr Speaker, after the election. A plan that we'd taken, which the opposition actually agreed to as to what was necessary for aged care. But in addition to that, we've provided an additional $624 million in the mid-year statement that followed it. In the recent July economic forecasting document, Mr Speaker, a further $813 million. Our government has been responding to those needs, Mr Speaker. Those opposite, Mr Speaker, may seek to come into this place and politicise aged care in the way they have been doing now for some time. But the truth is, Mr Speaker, the plans we have put in place, they have supported. They have supported those plans, Mr Speaker, and they did not offer 1 cent, one extra place on one occasion, Mr Speaker, and that's what speaks for itself.
Has the Prime Minister concluded his answer? The Prime Minister has indicated he's concluded his answer. I call the member for Kennedy.
To the Deputy Prime Minister, are you aware of the most serious concerns over why Townsville Enterprise is oversighting a small parochial weir in Charters Towers, and the more serious implications of Smec and Tell being again contracted to work on Hell's Gates? Their initial proposal destroyed Bradfield forever. Not one of the 15 reports on Bradfield and Hell's Gates has recommended a dam below 295 metres, high enough to gravitate water through the Great Divide. Can you ensure that your recent initiatives redirect certain responsibilities, ensuring a high dam?
The Deputy Prime Minister.
Thank you, Mr Speaker, and I thank the member for Kennedy's ongoing passion for water infrastructure in North Queensland and elsewhere in the nation. I share that vision, that passion for him, and I know that Deb Frecklington, the next Premier of Queensland, does so too. Also, she also shares that blueprint, that vision. Mr Speaker, John Bradfield was an outstanding engineer, and we all know that. Sydney Harbour Bridge, the electrification of rail projects, Mr Speaker, bridges, and of course he had that vision for water for our nation, and elements of which of course are part of the water infrastructure rollout that we are investing in right now. Now, the North Queensland Water Infrastructure Authority, it's headed by Richard McLaughlin. I know the member for Kennedy knows him well. It's got responsibility, as does the government, of course, as does the Queensland government, for Hell's Gate Dam scheme, including Big Rocks Weir, the Hewenden Irrigation Scheme, the Western Queensland Irrigation and agricultural projects. I know the member for Kennedy is parochial for Charters Towers. Population around 8,000. He wants to see that population increase, as does I, as does members of the government, Mr Speaker. For far too long, our regional communities have had either population decreases or they've remained steady. There's only one way that we're going to increase those populations in those particular regional communities, and that's to build the right infrastructure, whether it's water, whether it's rail, to grow agriculture from the $60 billion enterprise to $100 billion, of course, by 2030. And I know the member for Kennedy shares that vision with the National Farmers Federation, with the Agriculture Minister, with the government that sits on these benches. Mr Speaker, the Australian government has committed $24 million from the National Water Infrastructure Development Fund to fully fund a detailed business case and environmental impact statement. Mr Speaker, the first major project milestone has been achieved with the delivery of the final business case for Big Rocks Weir in August this month. The business case indicates the Big Rocks Weir will deliver strong benefit for the Charters Towers region and for Queensland. We need water for agriculture, we need it for resources. They're going to be the two big sectors, along with infrastructure, that's going to help us out of COVID-19, Mr Speaker. Benefits include more than 200 construction and agriculture jobs, improved water security for Charters Towers, and higher value irrigation opportunities for the region. And I know when it comes to Hewenden, Jane McNamara, the Mayor of Flinders, she's right behind those projects. I was with
the member for Griffith is now warned. The member for Hunter will cease interjecting.
Mr Speaker, the Australian government has committed $30 million to the immediate construction of the Big Rocks Weir. We want to build water infrastructure. Can't do it alone. Have to do it with state governments. Well, I'm looking forward after October 31 to be able to work with the LNP to be able to do just that.
The Deputy Prime Minister's
agriculture
time
through water infrastructure
has concluded. The members for Lyons and Hunter, that is your final mention. Okay, I'm not going to keep repeating myself about how I won't have any tolerance for loud and repeated interjections. It's all there in last week's Hansard. You'll have time to read it back in your office if you keep interjecting. I call the member for Higgins.
Thank you, Mr Speaker. My question is to the Treasurer. Will the Treasurer explain to the House how the Morrison government is securing Australia's future by building the road to economic recovery as we come out the other side of the coronavirus pandemic?
The Treasurer has the call.
Well, thank you, Mr Speaker, and I thank the member for Higgins for her question and acknowledge her experience before coming to this place as a Professor of Paediatrics and as a Fellow of the Australian Academy of Health and Medical Sciences, Mr Speaker. I hear lots of interjections from those opposite. They only wish they had the qualifications of the member for Higgins, Mr Speaker. Now, the reality is that COVID-19 has been an economic shock to Australia like no other, an economic shock on both the supply and the demand side. When we came to government, unemployment was at 5.7%. In February, we got it down to 5.1%, but it is the expectation that unemployment will reach around 10% by the end of the year. The Morrison government's response has been swift and substantial, Mr Speaker, with a JobKeeper program which is today supporting more than 3.5 million workers and around 1 million businesses. And it's a remarkable program, in the words of the Reserve Bank Governor himself. Now, businesses like the Gables, a wedding venue in the member's electorate, run by Jessica, has 10 people on the JobKeeper program. And she has said that the income has stopped, but the bills keep coming in, and without JobKeeper, she would be fearing for the future of her business, which she has been in possession of for the last 25 years. Now, Mr Speaker, it's not only JobKeeper, it's also the cash flow boost, which is providing support of up to $100,000 to small and medium-sized businesses to assist with working capital. It's also been the $750 payments that were provided to millions of Australians, including pensioners who are on income support. And these programs are working because of the 1.3 million Australians who either lost their job or saw their working hours reduced to zero since the start of this crisis. Around 700,000 are now back in work, Mr Speaker. 340,000 jobs were created in the last 2 months, and 58% of those jobs went to women, and 44% of those jobs went to young people, Mr Speaker. That is the positive sign of the programs that the Morrison government has undertaken. And our JobMaker plan continues to help businesses remain in business and Australians remain in jobs. For example, the work that we're doing on industrial relations, around casuals, around greenfield sites, around award simplification, infrastructure, bringing forward up to $10 billion worth of spending. When it comes to red tape, harmonising the occupational licensing laws around this country, the first time that would have been done after years of debate, Mr Speaker. Skills, 340,000 new places, training positions to help people equip for the jobs of the future, and of course tax with incentives like the instant asset write-off. This is the Morrison government getting on with creating and delivering jobs.
I now give the call to the member for Cooper.
Thank you, Mr Speaker. Is to the Prime Minister. The Prime Minister knows that moving between different facilities is a key driver of infection of the deadly COVID virus. Given the opportunity he had over the weekend, can he now advise whether aged care workers are still working across multiple facilities?
The Minister for Health.
Thank you very much, Mr Speaker. And as I advised in the press conference previously, we have AUSMAT workers that are working across a variety of facilities in Victoria. We have ADF facilities that have now completed a very significant number of cases. We also have testing capacity which is delivered across a variety of facilities. These are people working in aged care precisely because they need to deliver services to different facilities on different sites. In addition to that, following agreements between the unions and the providers, the work with the Commonwealth and Victoria, the Commonwealth Single Site Worker Scheme was put in place. That's a system which was designed to ensure that the overwhelming majority of workers do work on one site. The reason that provision has been made for individuals, and I think it's very important to be upfront about this, to be able to do that, is to leave no facility short of workers. I am sure that not one person here would support the concept that a facility should be left short of workers. And so the design...
Leader of the Opposition, Minister for Health has the call.
So the design that was adopted came from the sector in conjunction with the unions, with strong support to make sure that each individual facility was able to, the best of its ability, adopt a single-site worker program. But with ADF, with AUSMAT, with nursing support surge staff, for example, from Western Health, which has worked across, I believe, over 30 different sites, and with the testing facilities needing to work across a variety of facilities, it's fundamental that that flexibility is in place. However, having said that, the design of the overarching system was agreed with the workforce, it was agreed with the providers, it was developed with the Victorian government, and it was designed to make sure that two things occur. The possibility of workers working across multiple sites was dramatically reduced, but the capacity for each and every facility to have an unbroken workforce was maintained.
I call the member for Sturt.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister please update the House on how the Morrison government is investing in research into a potential COVID-19 vaccine, whilst also continuing to provide critical support to Australians by listing life-saving medications on the PBS?
The Minister for Health. The Minister has the call.
Thank you very much, Mr Speaker, and I want to thank the member for Sturt, who in a short time has come to this place as a great advocate for vaccines and for medicines under the Pharmaceutical Benefit Scheme. In terms of the Pharmaceutical Benefit Scheme—
Member for Rankin. The Minister has the call.
In terms of the Pharmaceutical Benefit Scheme, new medicines will be listed tomorrow, including for lymphocytic leukemia and lymphocytic lymphoma. Calquence is a medicine which will help over 1,600 patients have access to a life-saving or life-changing medicine that would otherwise have been beyond their reach, $140,000. Similarly, we now have, with Keytruda, a medicine for melanoma, a condition which can affect 15,000 Australians in any 1 year, and 850 will specifically benefit from Keytruda being expanded for a new indication in terms of melanoma, and that will assist 850 patients. It will allow them to access a medicine which would otherwise have cost $100,000 or more per year, and it will give them a real shot at life, a real chance to have the opportunity. And we know the history. We know that this is something that this side of government has been completely committed to as a fundamental tenet of belief. It's something which the Prime Minister and the Treasurer have been advocates of and supporters for, and we know this because of the history of that which was stopped in 2011. Having said that—
The member for McMahon.
Having said that, the other great task we are embarked upon at the same time is the search for a vaccine. We've invested $5 million in the University of Queensland molecular clamp. All up, we are investing over $350 million in vaccine research to help protect Australians as part of the first limb of our vaccine strategy. And what that means is that we're working in Australia on a homegrown protection, as well as at the same time working on international purchasing, where we've struck our first and most important first-stage agreement in relation to the AstraZeneca Oxford vaccine. Secondly, we are a part of the Gavi COVAX facility program, having completed all that can be done to this point in time. And then Thirdly, we are working on manufacturing agreements, particularly in Australia, for delivering the vaccines to Australians at the earliest possible time. So, in short, whether it's the PBS, whether it's vaccinations for Australians, these are fundamental tenets of faith for those on our side. We do this in a belief that they save lives and protect lives, and they will be fundamentally part of the road out for Australians.
The member for Franklin.
My question is to the Prime Minister. In its response to Newmarch House, the New South Wales government said it had to step in and ensure aged care facilities had a plan to deal with COVID-19 outbreaks because of an, quote, apparent lack of preparedness, end quote. Why was the New South Wales government forced to step in to do the Commonwealth's job? And isn't this just more evidence that the Prime Minister left aged care residents vulnerable to the deadly COVID virus because he didn't have a plan?
The Minister for Health.
Thank you very much, Mr Speaker. And as I tended to the Parliament last week in reading from both the pandemic health plan, which was published on the 18th of February and activated on the 27th of February, and also on the aged care plan, which was published on the 13th of March and activated as of that day following the advice of the Communicable Diseases Network of Australia, and in addition to that, the Australian Health Protection Principal Committee. There is a fundamental pairing of actions here. Firstly, overall responsibility for funding and regulation in aged care sits with the Commonwealth. Overall response for public health in any circumstance where there is an outbreak rests with the states, and so therefore there is close cooperation. In particular, that is why we set up 4 fundamental pillars in response to this risk to Australians in aged care. Firstly, on the 11th of March, we set up the surge workforce capacity with $101 million. Secondly, on the 13th of March, we set up the public hospitals response and the public hospitals agreement, which has been used widely in Victoria. Thirdly, on the 31st of March, we set up the National Partnership on COVID-19 response, which brought 57,000 nurses and 104,000 private hospital staff into the fight to protect our hospitals and our aged care residents. And then fourthly, in April, we also set up the national testing contract for every site around Australia with even one positive case to have every worker and every resident tested. As part of that, in relation to Newmarch, we did work very closely with the New South Wales Government and the Public Health Unit, which did take the lead as per the CDNA and as per the public health agreements, precisely in line with that which had been agreed, precisely in line with the structures. And I want to thank them for what they did as part of that work. I also want to thank the independent assessor, Professor Gilbert, who, at our request, inquired into the responses in both Dorothy Henderson Lodge and Newmarch. In particular, the important thing here is that what we've been able to see is a cooperative outcome, and we've been able to build with those 4 pillars on the protections. Every day, though, every day we fight to protect these lives, and every day we recognise that there's a global pandemic which targets the elderly by the very nature of this disease, which is why we've taken the measures which have been so difficult and challenging for Australians, and it's also why we have focused so specifically from the outset, with the first of the major actions with regards to aged care occurring on the 31st of January. We'll continue fighting to help protect and save every life.
I call the member for Boothby.
Thank you, Mr Speaker. My question is to the Minister for Industry, Science and Technology. Will the minister outline to the House how the Morrison government is supporting the road to recovery from the economic effects of the coronavirus pandemic by backing innovative Australian businesses to take their products to the world and be part of global supply chains?
The Minister for Industry, Science and Technology.
Thank you, Mr Speaker, and I thank the member for her question. Now, Mr Speaker, while businesses and communities across our nation have been suffering from many restrictions and challenges as part of COVID-19, it's very important that we also make sure that we are focusing on our future. Now, our government understands that the key to our economic recovery is making sure that our businesses are resilient, that they are competitive and that they are in a position that they can scale up to take on the world. And that's exactly what we are doing. Now, last week I opened new grants for Australian businesses so that they can be part of the global space industry supply chain and participate in NASA's Moon to Mars project. Now, Mr Speaker, let me be clear. This is not money that is going to NASA. This is money that is going to Australian businesses so that they can be part of the supply chain for that Moon to Mars project. Now, the member for Boothby has visited the Australian Space Agency in Lot 14 a number of times, so she is very much aware of the Australian Space Agency, the work that they are doing and the work that they are doing to help specifically our businesses to grow. And we are making sure, Mr Speaker, that we do continue to grow and support the Australian space industry as it grows to achieve the target of tripling in its size by 2030. Now, Mr Speaker, there's also work that we are doing to support businesses that have already developed some great innovations but need some assistance to take those products to market. We have in place a program, the Accelerating Commercialization Grants program, and I recently announced that there were 12 Australian businesses that were going to share in $5 million worth of grant funding to take their products to the world. Now, that includes $500,000 for Fireball International for their pioneering product to detect and report on bushfires. Now, Fireball's system means that fires can be detected in, quite frankly, about 3 minutes, which is exactly one of the products that we need to be supporting. There are other grants that we are also supporting, other products that we are supporting as part of this program, a project that turns waste into activated carbon and a new system that enhances flavour and storage of food products. Mr Speaker, this is Aussie ingenuity at its absolute best, and that's exactly what we need at this point in time. Mr Speaker, we understand that economic recovery is not just about keeping businesses in business, but helping them grow and create the jobs of the future.
The member for Franklin.
My question is again to the Prime Minister. The New South Wales Government says it was forced to take, I quote, assertive action to clarify the responsibility of the Commonwealth and the Commonwealth regulator during the deadly COVID outbreak at Newmarch House. Why did the New South Wales Government have to tell the Commonwealth to do its job and protect frail and vulnerable aged care residents?
The Prime Minister.
Thank you, Mr Speaker. The responsibilities of the Commonwealth have been well set out. I've set them out to this House on many occasions, and they're well understood. We're responsible for the regulation and funding of aged care facilities, Mr Speaker, and that's why we continue to invest $1 billion and more every year in our responsibilities to ensure that our elderly residents in our communities are looked after as best as we can possibly in their homes or in those facilities themselves, Mr Speaker. Those responsibilities are very clear, and when there is an overlap with public health responsibilities, whether it's in New South Wales or Victoria or any other place, we've worked also very constructively together with the Queensland Government when it comes to these matters. The Queensland Government's response plan has proved also very effective, working in with the federal government's plan, and that has ensured that in relation to outbreaks there we've been able to limit any further impact in those places. So, Mr Speaker, our plan, our responsibilities, Mr Speaker, are very clear, and we will continue to fulfil those responsibilities with more than $1 billion every single year in support for the aged care sector.
The member for Robertson.
Thank you, Mr Speaker, and my question is to the Attorney-General and Minister for Industrial Relations. Will the Attorney please update the House on how the Morrison government's JobKeeper program and its important industrial relations flexibilities is supporting the road to recovery from the economic effects of the pandemic?
The Attorney-General and Minister for Industrial Relations.
Thank you, Mr Speaker, and I thank the member for her question and her great support and advocacy, particularly for small and medium-sized business. And the JobKeeper changes that we made earlier this year, of course, provided critical IR flexibilities to businesses, and 95% of the businesses who had the benefit of those flexibilities on JobKeeper were small and medium-sized businesses. 95%. And there have been an enormous number of businesses contact the government and describe how critical those flexibilities were and are. One of them, in this example, was an Australian-owned tourist coach business which had been operating pre-COVID since 1926. They said the flexibility arrangements allowed our company to reduce hours of work to in part meet the drop in company revenue. Without these flexibilities, we would have reduced staff numbers and or possibly shut down altogether without the flexibilities. Now, the government is very clear in its position. We think that those flexibilities should be extended to those businesses that were in extreme distress but are still now in very significant distress. Now, members opposite's position about this legacy group of businesses, as we've described them, is very clear. They have simply said, as the member for Watson said, we don't agree with that. And the reason that they don't agree with that, notwithstanding that these flexibilities are business and job-saving lifelines for many businesses in Australia, is because, as the member for Watson has argued, the position of members opposite is that the flexibilities could allow someone on a minimum wage being worse off. Now, the first problem with that argument is it ignores that the very real-world alternative is that that person doesn't have a job because the business fails. Yeah. That's what it fundamentally ignores. And there are other further problems. The figures that were used by the member for Watson do not take into account the fact that these can be used in conjunction with JobSeeker, the wage, and we are increasing the income-free area from $106 to $300, which seriously mitigates any form of loss. Another problem is it ignores the fact that there are built-in protections.
Members on my left.
The direction can only be given if the employee cannot be usefully employed for normal hours because of changes. But the final and most interesting problem is that it is the exact opposite of the position that you had earlier argued. And the member for Watson said, well, you have to look at the goodwill that's out there. And he referred to an agreement between the Australian Hotels Association and the United Workers Union, where he said full-timers, they'll be able during this time to significantly cut how many shifts they've got, but to keep them on the books. Businesses understand how important it is to keep these people on the books. And what was that with respect to? A 60% reduction down to 60% of the hours. Exactly what we are doing now, except on the time that you supported it, there were no protections built in.
The member for McMahon.
Thanks, Mr Speaker. My question is to the Prime Minister. This month the Aged Care Royal Commission heard that after the deadly Newmarch House outbreak, the Commonwealth still doesn't have protocols with all states, stating it is unacceptable that such arrangements were not in place in February. It is unforgivable that they are still not in place in August. After hundreds of deaths, why are Commonwealth-funded and regulated aged care facilities still unprepared for an outbreak of COVID-19?
The Minister for Health.
Thank you very much, Mr Speaker, and I'll directly turn to the national standards that were established in conjunction with the states and territories as part of the Australian Health Sector Emergency Response Plan for novel coronavirus COVID-19, released on the 18th of February, activated on the 27th of February. And I will read it absolutely. And in section 4.14, which addresses the relationship precisely between the Commonwealth and every state and territory. That says the Australian Government will also be responsible for residential aged care facilities, working with other healthcare providers to set standards to promote the safety and security of people in aged care and other institutional settings. It goes on to state, state and territory governments are responsible for the operational aspects of public health responses. This document was passed through
Member for Franklin.
The AHPPC, or the Australian Health Protection Principal Committee, or the Medical Expert Panel. And state and territory governments will implement infection control guidelines and healthcare safety and quality standards. They will establish systems to promote the safety and security of people in aged care and other institutional settings and support outbreak investigation and management in residential aged care facilities, schools, prisons and other institutions. Equally, specifically and exclusively in relation to aged care, the National Aged Care Plan, published on the 13th of the 3rd of 2020, developed through the Communicable Diseases Network of Australia, which is a subcommittee of the Australian Health Protection Principal Committee or Medical Expert Panel, said very clearly that in relation to the respective responsibilities of the Commonwealth and the state and territories, that the state and territory departments of health, or public health section of the Department of Health, will act in an advisory role to assist residential care facilities to detect, characterise and manage COVID-19 outbreaks. This includes assisting facilities to confirm outbreaks, providing advice on obtaining testing samples, providing guidance on outbreak management, monitoring for severity of illness, including recording deaths and hospitalisations, informing relevant stakeholders of outbreaks, informing clinical care providers in the local health district. Both of these are the foundational documents of the National Aged Care Preparedness COVID Plan. Both were developed in conjunction with the states and territories. Both share and assign responsibilities appropriately across Commonwealth and state and territory bodies. Both are published documents. Both have been available since February the 18th and March the 13th, respectively. Both are available, and most significantly, they have actually provided the framework for cooperation which has allowed thousands of lives to have been saved. We grieve every life lost, every single life lost. But we also know that what we've done through containment and capacity has made a profound difference and will continue to do and fight for every life.
And I call the member for Braddon.
Mr Speaker, my question is to the Minister for Defence Industry. Will the minister outline to the House how the Morrison government is supporting the road to recovery from the economic effects of the pandemic by backing Australian jobs through the investment in our defence industry?
The Minister for Defence Industry.
Thank you, Mr Speaker, and can I thank the member for Braddon for his question and acknowledge his 20 years of distinguished service in the Australian Army, and thank him for his passion for Australia's defence industry. Mr Speaker, the Morrison government is supporting our road to recovery, supporting Australian jobs with our $270 billion investment in our Australian defence capability. Mr Speaker, in February I announced our plan to put small defence industry front and centre with our decision-making. And over the last 6 months, even during these challenging COVID times, we have been able to achieve systematic changes with respect to decision-making and defence industry. I've got three that I want to mention. Firstly, reform of the Commonwealth procurement rules. Now, this sounds like a very dry, finance department type of issue, but let me tell you, the defence industry—
Member for Burt is now warned.
The defence industry participants in Australia understand how important it is that when defence now are considering procurement decisions, that they will consider Australian industry content, they will consider sovereign industrial capability, and they will consider workforce issues, skilling issues. So this is incredibly important to Australian defence industry, and industry has welcomed these changes. Secondly, we have delivered an independent ARC audit program so that we now will be able to audit companies on their ARC obligations. And what that means, Mr Speaker, is if they do not comply, they are less likely to get more work from this Australian government with respect to defence industry. And thirdly, we have finalised our enhanced ARC contractual framework. This makes sure that small and medium-sized Australian defence industries are front and centre when it comes to making defence program decisions in our nation. Mr Speaker, just to illustrate the defence industry capability of our nation, today, with the Minister for Defence, we will proudly announce that Collins Aerospace Australia has delivered its 1,000th infrared imagery capability for the global F-35 Joint Strike Fighter program. This is a huge achievement, and we proudly was able to contribute $1 million to a grant program to assist them with this work. We're very proud of our contribution to the F-35 global program. $1.7 billion worth of Australian contracts, some 50 Australian contractors are involved in the Joint Strike Fighter program, which is supporting some 2,500 Australian jobs. So every day we're thinking about what are the barriers to small and medium-sized defence companies in Australia, and one by one we are knocking them down to make sure they are at the centre of our decision-making, supporting Australian jobs. More importantly, we are creating more jobs.
And I call the member for Fremantle.
My question is to the Prime Minister, Mr Speaker, and this is from Jane, speaking about the moment she was told her father had died from COVID-19 in aged care. I started crying and I said, "Why didn't anyone call? Why didn't anyone call? I've been ringing and ringing." And they said, "Oh, he was fine this morning and he was fine this afternoon, but when I checked on him, he'd passed away." Prime Minister, why are aged care residents and their families not getting the support and information that they need and that they deserve.
The Prime Minister.
Mr Speaker, I thank the member for his question. Jane was referred to. I'd be very grateful if you could let me know what facility you're referring to. Happy to provide a further response to the response I'll give now, but it's difficult to do that without knowing what facility you're referring to, and I appreciate that might be for privacy reasons that you wouldn't want to raise that in this forum, and so I'd be happy for you to raise that through to the Minister for Health in terms of his responsibilities in this House, and we can provide a further response. One of the key lessons out of the Newmarch report was the provision of communications, and I want to thank particularly the member for Lindsay, which is in the roster to be in the chamber today. But that was one of the issues that she worked closely on in dealing with that issue at Newmarch. Now, that is why, as part of our response across all the acutely affected facilities in aged care in Victoria, there was additional funding and support provided for Services Australia to provide the process of having outward calls to people and to all the families to give them a daily update, because it wasn't just the aged care workforce that was on the nursing side that was actually depleted in a number of these cases, but it was also the support teams in the administrative areas that was also affected. And that's why the Services Australia support was put in to make sure that these outward calls were occurring, and there are many facilities where that was done. And so that's why I'm keen to know in which facility you're saying this took place, so we can follow that matter up. Of all the 457 deaths, Mr Speaker, that has occurred, with the passing of any loved one, even in better times, these are very difficult issues for any family to deal with. And so I pass on my condolences to Jane and her family, and we will look specifically at the issue that you've raised and be pleased to take that up and come back to you.
The member for Wentworth.
Thank you, Mr Speaker. My question is to the Minister for Communications, Cyber Safety and the Arts. Will the Minister outline to the House how the Morrison government is supporting the road to recovery through the pandemic through its ongoing investment in the digital economy?
The Minister for Communications, Cyber Safety and the Arts.
Well, I do thank the member for Wentworth, who has very distinctive expertise when it comes to the digital economy, including from his time as Australia's ambassador to Israel, a country with remarkable achievements when it comes to the digital economy, a country from which we can learn much, but a country against which we can in many ways compare very favourably as well. Now, the platform, Mr Speaker, for our digital economy is the national broadband network, and 99% of premises around the country are now able to connect. 11.7 million premises. There are 7.4 million that are connected. That number's up 31% in just 1 year. Around 30,000 a week are connecting to the NBN. Mr Speaker, in every 2 weeks we are connecting more people to the NBN than were connected to the fixed line network in the entire 6 years that Labor were in power. What we're also seeing is a huge rise in the amount of data being carried over the NBN, 297 gigabytes a month in the June 2020. That's up from 27 gigabytes just 8 years before, an extraordinary increase in the amount of data, and over 2/3 of Australians on the NBN now taking a 50 megabit per second or higher speed. And of course the prices are coming down, Mr Speaker, from 2014-15 to 2018-19. The price of the 50 megabit per second plan down by 37%, according to the ACCC. Now, this is delivering real efficiencies to small businesses, cheaper and more widely available broadband. It lets small businesses use the latest software delivered over the cloud. It lets them serve a bigger addressable market, and it gives people more choice in where to locate their business. And so businesses like Power Creative, a video content production company in Blacktown, uses the NBN with cutting-edge software so that their clients can view and comment on their content as it's being edited in real time. And David and Erin Power credit the NBN with helping them to expand their business. Mr Speaker, of course, we're already preparing for the growth of 5G with an auction of spectrum coming up next year, and the NBN is key to our nation's economic recovery. Well, Mr Speaker, just imagine if we were still back in Labor's NBN with barely over 50,000 premises connected after 6 years. It was like the Soviet 5-year plans exhorting the comrades to increase their tractor production, but the fact is they missed their 2013 target by 80%, Mr Speaker. They missed it by 80%. No order of the Soviet revolution under when the current leader of the opposition was the Minister for Broadband. He missed the targets hopelessly. We're delivering, and it's a platform for the growth of our digital economy and the way out of this current economic downturn.
I now give the call to the member for Lawler.
Thank you, Deputy Speaker. My question is to the Prime Minister. 100 metres from where I asked this question, in the heart of my electorate, is Bapcare Wyndham Lodge. Prime Minister, how many residents at this facility have died from the COVID outbreak? Does the Prime Minister accept responsibility for his failure, which left all aged care residents more vulnerable to the deadly COVID virus?
The Prime Minister has the call.
Thank you, Mr Speaker. I thank the member for her question. There have been 10 deaths at the Bapcare Wyndham Lodge. There have been 80 residents that have tested positive for COVID-19, 86 staff. I understand that the number of residents currently in hospital is 4. This was one of those very significantly affected facilities that I referred to in response to answers last week, Mr Speaker. Bapcare Wyndham Lodge notified the Department of Health that it had a positive case on the 16th of July. The Department of Health tailored specific support as soon as this notification occurred. Testing of residents and staff commenced at Wyndham Lodge on the 18th of July. The Australian Government provided a range of surge staff, including through the National Aged Care Emergency Response Teams from the 24th July, including a clinical first responder nurse. AUSMAT teams also provided on-site advice to the service regarding deep cleaning, infection control, cohorting of residents and safe waste management. An independent advisor has been appointed to Bapcare Wyndham Lodge, Mr Speaker. These are the responsibilities that we have, and as I've said and apologise previously to those families and the residents of the most affected, so there were 4 in particular that were acutely affected with unacceptable outcomes. And Mr Speaker, as difficult as that has been, our concern, frankly, with the rate of COVID infection that was occurring in the community in Victoria, that this may have spread to many more facilities. As we've seen overseas, Mr Speaker, in the United Kingdom, some 56% of facilities have had COVID infections amongst staff and amongst residents. In Australia, that figure is 8%. And so, Mr Speaker, what has occurred at Bapcare Wyndham Lodge is very, very concerning and very, very troubling, but I've set out the actions the government has taken in relation to that, and to the families of those 10 Australians who passed away as a result of COVID-19, I extend my sincere condolences.
And I call the member for Flynn.
Thank you, Mr Speaker. My question is to the Minister of Agriculture, Drought and Emergency Management. Will the Minister outline to the House how the Morrison-McCormick government is supporting the road to recovery from the economic effects of the pandemic through its investment in agricultural research?
I call the Minister for Agriculture.
Well, thank you, Mr Speaker. Can I thank the member for Flynn for his question and acknowledge the rich contribution that Flynn makes not only in the agricultural sector but also in the resources sector towards our nation's economy and reaching the ambitious agricultural goal of $100 billion by 2030. And one of the biggest investments that the government can make in agriculture achieving that is in our most precious resource, our human capital. And the government is working closely with our research and development corporations, the 15 research and development corporations, to help achieve that $100 billion goal by 2030. And each year, the government, industry, levy payers contribute over $1.1 billion towards research and development to make sure that we are giving our farmers the tools of the 21st century, the cutting-edge science and technology that allow them to get the production and profitability targets that we're looking for to make this a $100 billion industry. And I'm pleased to say that the Innovation Modernisation program that I announced in 2019 after the EY review is well underway, and working with those 15 RDCs, getting back to our core principles about making sure that there's value for money to the levy payer and to the taxpayer, making sure that there isn't duplication of research
We are seeing where, of those 15 RDCs, where cross-sectorial research is being undertaken by 4 or 5 of them. That's not an efficient use of taxpayers' money or levy payers' money. We're also working through ensuring there's better collaboration, commercialisation of the research, because what a failure in one RDC may be a success in another. We're creating a Grow Ag website that will make sure that coordinates it and there's accountability and transparency back to the levy payer to make sure that everyone understands exactly where their levy dollar is going. But we're also undertaking what the states have let us down on, the extension and adoption work. The states have walked away from this, so I'm pleased to say that the Prime Minister and I have announced a further $86 million. Yeah, that's right. $86 million for 8 new research and development hubs out in the regions, out amongst the farmers, the ones that we want to adopt the new technology, the science, to be able to get them to be more productive to support regional and rural Australia. We'll intertwine that with the drought research hub so that there isn't any overhang or waste of taxpayers' money, but this is a practical step, a practical investment in research and development in our primary production systems. We, in that EY report, were labelled at number 20 in the world for research and development. The United States and Netherlands are ranked at 4 and 6 in the world and have the same number of researchers than they do to Australia. So I've challenged our RDCs that by 2030 we can reach number 1 with the investment that we continue to put in, because this can become another pillar of agriculture, to reach that $100 billion, the new jobs of agriculture, to bring our young people home to agriculture in the smarts of agriculture. This is an investment not just in agriculture but also regional and rural Australia.
The Leader of the Opposition.
Thanks, Mr Speaker. My question is to the Prime Minister. Why is the Prime Minister spending his time fighting with state premiers instead of fixing an aged care system that is in crisis and an economy that's in recession for the first time in 30 years?
The Prime Minister.
Thank you, Mr Speaker. Throughout this COVID-19 pandemic, states and territories, together with the Commonwealth, have been able to put Australia in a position where not only, when you look at the international comparisons, has Australia fared well than almost any other developed nation in the world when it comes to the health outcomes, Mr Speaker, but also when it comes to the economic outcomes. The response has been put in place, led by the Commonwealth, with over $300 billion of support, which I note, Mr Speaker, in a report conducted by the Australian National University, found that in the absence of those policy interventions, Mr Speaker, the number of persons in poverty would have increased from 1.6 million to 3.8 million people, Mr Speaker. So 2.2 million
members for
people
Rankin and Sydney
have been, through the research done by the ANU, identified as being saved from poverty as a result, Mr Speaker, of the responses that we have put in place. Now, across the states and territories, we have worked together as a national cabinet, Mr Speaker, to achieve many things together. There have been some areas of disagreement, I grant you that, Mr Speaker, but compared to the way the states and territories and the Commonwealth would argue under COAG and issues went, Mr Speaker, largely to retire rather than to be promoted, the national cabinet has gone the other way. Whether it's the achievements we've been able to make on the EPBC Act in reducing regulation, in particular the work of the Western Australian government, working with the Commonwealth government, whether it was the $1 billion in skills funding agreement that will see 340,000 additional training places put in place, whether it was the National Freight Code or indeed the Agriculture Code, which will be considered by the National Cabinet, the occupational licensing agreements that have been put together. Mr Speaker, we will continue to work together on these important issues. But what is really important now, Mr Speaker, as we go forward, is there is no dispute. There is no dispute from the Commonwealth about the powers that the states and territories have when it comes in relation to borders. There is no dispute about those powers, Mr Speaker, but it is also the point that what we want to be able to achieve together is the road back. Is the road back, Mr Speaker, for our economy to ensure that we can see the jobs continue to come back in our economy, whether it's in New South Wales, Queensland, Western Australia, Tasmania or anywhere else. And just as the National Cabinet worked together to put the 3-step plan in place that was overwhelmed by the resurgence of the virus in Victoria, we will build that plan again, Mr Speaker. We will together get the road back, Mr Speaker, and we will continue to outline those plans together with the states and territories on how the economy can open up again, because that must be our goal. We can't retreat, Mr Speaker. We must always go forward when it comes to battling this virus, and that is what the Commonwealth Government is doing in partnership with the states and territories.
I now give the call to the member for Fairfax.
Thank you, Mr Speaker. My question goes to the Minister for Energy and Emissions Reduction. Will the Minister update the House on how the Morrison government's gas plan will support the road to recovery from the economic effects of the COVID-19 pandemic by delivering the affordable and reliable energy that Australians rely on?
The Minister for Energy and Emissions Reduction.
Well, thank you, Mr Speaker, and I thank the member for Fairfax for his question. He's focused, like all of us on this side of the House, on affordable, reliable energy and gas working for all Australians, Mr Speaker. And as someone with 20 years' experience in business, he knows the important role gas plays in the economy. And he knows that the path out of COVID includes affordable, reliable gas driving jobs, driving investment and driving the economy, Mr Speaker. Now, gas is important for affordable, reliable electricity. It plays that role, but that's less than half of the use of gas. The other use is as an industrial feedstock, a chemical feedstock, and we just heard from the Minister for Agriculture talking about a $100 billion agriculture industry. Well, that can't be achieved without large growth in nitrogen fertiliser, and that is made, Mr Speaker, from gas. It's made from gas. Now, Mr Speaker, even before the pandemic hit, we were seeing large reductions, substantial reductions in the wholesale price of gas, 42% reduction. That was confirmed recently by the AER, who said that we're now seeing wholesale gas prices at the lowest levels we've seen for years, Mr Speaker, and that's helping to drive down wholesale electricity prices. A 42% reduction in wholesale electricity prices before the pandemic hit, Mr Speaker. That means that all Australians will benefit from a gas-fired recovery. Now, Mr Speaker, gas provides flexible, reliable energy that is a complement to solar and wind, and we've seen record levels of investment in renewables in 2019, and the Clean Energy Regulator tells us that we'll see similar levels this year. Last year we saw $9 billion of investment in solar and wind. But for the renewable sector to continue to grow, the grid must be balanced, Mr Speaker. We know that gas is the perfect partner to intermittent renewables. The Chief Scientist has said as much. Far from competing with renewables, Mr Speaker, it complements them. It complements them by helping to stabilise the grid, reduce emissions, Mr Speaker, and drive lower prices. And that's why we've recently introduced to this place the Grid Reliability Fund, a $1 billion fund focused on dispatchable generation and transmission, Mr Speaker. Now, Mr Speaker, there are many who agree with this. I've mentioned just a moment ago the Chief Scientist, who agrees on the complementary role of gas with renewables.
Member for Kingston.
The member for Hunter agrees. The member for Hunter agrees, and he said just last week, we will need more gas. We will need more gas, Mr Speaker. Like the Narrabri project in New South Wales, 1,300 jobs, more than half of New South Wales's gas requirements, Mr Speaker. Unlike those opposite, when it comes to gas, we know where we stand. Reliable energy, lower prices, lower emissions.
The member for Brand.
My question is to the Prime Minister. The commissioners presiding over the Aged Care Royal Commission have said, had the Australian Government acted upon previous reviews of aged care, the persistent problems in aged care would have been known much earlier and the suffering of many people could have been avoided. Why is the Prime Minister refusing to take responsibility for the avoidable suffering and death which his failures have caused?
The Prime Minister.
Thank you, Mr Speaker. I've already said on numerous occasions in this place the responsibility that we've taken and, Mr Speaker, the apologies that have been absolutely necessary. This is what we've announced since the Royal Commission was called, when I called that Royal Commission. $3 billion since the 2018-19 budget into home care packages, 14,275 new residential care places, including 13,500 residential places and 775 short-term restorative care places, $5.3 billion from the 1st of July 2020 to June 22 to existing Commonwealth home support programs, service providers to ensure continuity of in-home support services for over 840,000 older Australians across Australia, $21.6 $1.9 million for my aged care operating costs, $320 million boost to residential care subsidies, giving service providers operation on residential home care to independent business advisory services. All programs going forward into the future, Mr Speaker, I note. Provided almost $50 billion for a business improvement fund to assist residential care providers in financial difficulty, providing 30% increase to the viability supplement to support services in rural and remote Australia, a 30% increase to the homelessness supplement, established a new independent aged care quality and safety commission, implemented new consumer-focused aged care quality standards, introduced a mandatory national quality indicator program, put in place a new single charter of aged care rights, provided $5.6 million, Mr Speaker, to implement phase 1 of the home care compliance framework, implemented new provider requirements to minimise physical and chemical restraint in aged care, $25.5 million, Mr Speaker, to improve medication management, noting this may also assist to reduce the use of chemical and physical restraints. And I note, Mr Speaker, all of these measures, and there are many more. There are many more, Mr Speaker, and I know they've all been done with the support of those opposite, I understand in most cases, if not all cases, Mr Speaker. These are the actions that we continue to take. This is, Mr Speaker, since only the Royal Commission was announced, and that demonstrates that the government will continue to take action each and every day, as we indeed have again today, with over $500 million to further extend the COVID-19 supplementary arrangements for aged care support to ensure that those facilities are both supported both from a viability basis and also from when I say a viability basis, to ensure that they have the additional resources to provide the COVID support in those facilities and also the workforce supports. Mr Speaker, to retain that workforce that is so necessary. We are investing more than $1 billion a year extra in aged care every single year. And, Mr Speaker, I return to the point that I made earlier today, and that is at the last election when we set out our aged care plan, when we set out the aged care in-home care places, in particular policies that we thought were necessary to address the additional demands in aged care, they were supported by the Labor Party at that election, and they did not offer one extra cent. They did not suggest, Mr Speaker, one extra place in in-home aged care at that election.
And I call the member for Malley.
Thank you, Mr Speaker. My question is to the Minister for Regional Health, Regional Communication and Local Government. Will the minister update the House on how the Morrison-McCormack government is investing in the health of regional Australians during the COVID-19 pandemic and beyond?
The Minister for Regional Health, Regional Communications and Local Government.
Thank you, Mr Speaker. I do thank the member for Malley for her question. And like me, she understands that this government backs regional Australia. And the regions have handled this coronavirus pandemic very well. We've had some outbreaks, but largely been managed quite well. And so the future for regional Australia is strong. Only last Friday at the summit in Cooma, the Regional Australia Institute has recognised that there are 40,000 job vacancies in regional Australia now. But it doesn't. We also have a plan to manage COVID in the regions, and it's important to note that of the 140 GP-led respiratory clinics around Australia, many of those have been in the regions, and the member for Malley has actually been very active in her electorate, as have many other members right across the House, in identifying the role that these clinics have in testing and keeping up to date with the information that's required. Understanding that in some cases more unwell patients would need to be moved to other areas, and so that's why we've upgraded the retrieval capacity of the Royal Flying Doctor Service and Care Flight by an injection of another $52 million there, so we can remove those people. We've also had there's a $74 million rural health package, and probably the success story has been telehealth. As we speak today, Mr Speaker, there's been 27 million consultations by 10 million Australians on telehealth. And so for a policy that was developed very, very quickly, it's been very, very effective. And so in more remote areas, the $5.8 million for point-of-care testing in remote and Indigenous communities under the leadership of the Minister has also kept those communities safe. But I'd like to give a shout-out today, Mr Speaker, to the rural health stakeholders. I've been meeting with them since February on a regular basis. All the peak bodies from the Rural Doctors Association, RACGP, AMA, Pharmacy, Allied Health, Indigenous Health, and that's been a vital tool for them passing through information on behalf of their members to the government so that we can react and respond in a timely fashion. So, Mr Speaker, regional Australia is showing very strong tendencies for the future, and that's why this government has invested $550 million in the Rural Health Strategy. And since 2018, we've seen 800 nurses and 900 doctors added to rural workforce because of these programs. Mr Speaker, regional Australia is the future.
The Minister's time has concluded. The
Mr.
Prime Minister.
Speaker, I ask that further questions be placed on the notice paper.